Good evening to all. Today's topic Berg balance scale. What is the Berg balance scale? Introduction. The Berg balance scale, or a BBS, is a widely used clinical test of a person's static and dynamic balance abilities named after Catherine Berg, one of the developers for the functional balance test. The Berg balance test is generally considered to the gold standard. The test takes the 50 to 20 minutes and comprises a chase of 14 simple balance related tasks ranging from the standing up from a sitting position to a standing on one foot. The degree of success in achieving each task is given a score of 0, unable to afford independent, and the final measure is sum of all the scores. The BBS is a more effective in identifying those who will fall more than once than those who have fallen in one time only. They suggest a cutoff scores of a 40 to predict those who will experience multiple falls and injurious falls. In a score of 36 or less indicated a nearly 100% chance of falling in the next 6 months in older adults. The Berg scales, the BBS, is less useful in conforming someone is at low risk of falling. Second point, the event subject to achieve a very higher scores, the 53 to 54 or 56 only have a moderate assurance that they are not at risk for a fall in the time of the few months. The BBS is a particularly helpful in determining sitting and standing balance. No measures of a gait are directly recorded within the scale. Procedure. What is the process? The patient is evaluated and graded on a sequence of a balance activities. The scoring for each task ranges from the 0 to 4. A score of a 0 indicates that the patient is unable to complete a particular task. A score of indicates the score of the 4 indicates that the patient can completely carry out the task. The 14 tasks consist of sitting to a standing unsupported, a sitting unsupported, a standing to sitting, transfer, a standing with eyes closed, a standing with the feet together, reaching forward with an outstretched arm, retrieving object from floor, turning to look behind, turning 360 degrees, placing alternate the foot on a stool, standing with one foot in front of the other foot, standing in one foot. Outcome measures. What is the outcome measures? So the Berg balance scale is used by a physiotherapist and the occupational therapist to determine the functional mobility of an individual. This test can be administered prior to treatment for elderly individual and the patient with a history of the but not limited to stroke. multiple sclerosis, Parkinson's disease, ataxia, vertigo, cardiovascular disease, and the respiratory disease. The BBC test, the Berg balance test, can be administered every few months of the treatment to determine if the treatment was effective for increasing the patient's the functional mobility. That's the a difference of the 8 point is considered a significant change. Scoring and interaction. The scoring, a 5 point ordinal scale ranging from the 0 to 4. 0 indicates the lowest level of the function. 4 indicates the highest level of the function. Interaction 41 to 56 the low fall risk. 21 to 40 that's medium fall risk. 0 to 20 scores the high fall risk. And the less than the 36 that is fall risk to 100%. Below or less than the 20 wheelchair user, more than 20 less than 40 walking with assistance, and the more than the 40 less than the 56 the independent. General instruction. Please demonstrate each task and or give instruction. When scoring, please record the lowest response categories that applies for each item. In most items, the subject is asked to maintain a given position for a specific time. Progressively more a point are dedicated if the time or a distance requirement are not met if the subject performance warrants supervision or if the subject touches and external support or receives assistance from the examiner. Subjects should understand that they must maintain their balance while attempting the task. The choice of which leg to stand on or how far to reach or leave to the subject. Poor judgment will adversely influence the performance and the scoring. Equipments required for testing are the stopwatch or a watch with a second hand and a ruler or other indicator of the 2, 5 and 10 inches. That's the 5, 12 and 25 centimeters. Chairs using the during testing should be reasonable height, either or a step or a stool of average step height may be used for item as 12. First, sitting to standing. Instruction. Please stand up. Try not to use your hands for support. 4. Able to stand without using hands and stabilize independently. 3. Able to stand independently using hands. Second, able to stand using hands after several tries. 1. Needed minimal air to stand to stabilize. 0. Needs to moderate or maximal assistance to stand. Second, standing unsupported. Instruction. Please stand for 2 minutes without holding. 4. Able to stand safely 2 minutes. 3. Able to stand 2 minutes without supervision. 2. Able to stand 30 seconds unsupported. 1. Needed several tries to stand 30 seconds non-support. 0. Unable to stand to 30 seconds unassisted. If a subject is able to stand 2 minutes unsupported, scores Full point for sitting unsupported proceeds to item 4. 3. Sitting with the back unsupported but feet supported on the floor or on a stool. Instruction. Please sit with the arm folded for 2 minutes. For able to sit safely and securely 2 minutes. 3. Able to sit 2 minutes under supervision. 2. Able to sit 30 seconds. 1. Able to sit 10 seconds. 0. Unable to sit without support 10 seconds. Standing to sitting. Instruction. Please sit down for sit safely with minimal use of hands. 3. Control descent by using hand. 2. Uses the back of the leg against the chairs to control a descent. 1. Sit independently but has uncontrolled descent. 0. Needs to assist to sit. 5. May transfer instruction. Arrange chairs for a pivot transfer. Ask subject to a transfer. One way toward a seat with the arms raised and one way towards the seat without arms raised. You may use to a chair, one with and one without a armrest, or a bed and a chair, for able to transfer safely with the minor use of hands. 3. Able to transfer safely definite needs of hands. Second, able to transfer with verbal cues and or a supervision. One needs one person to assist. 0 needs two people to assist the supervised to be safe. 6. Standing unsupported with the eyes closed. Instruction. Please close your eyes and stand still for 10 seconds. For able to stand to 10 seconds safely. 3. Able to stand to 10 seconds with supervision. Second, able to stand for 3 seconds. 1. Unable to keep eyes closed 3 seconds but stay steady. 0 needs to help to keep from falling. 7. Standing unsupported with feet together. Instruction. Place your feet together and stand without holding. For able to place two feet together independently and stand 1 minute safely. 3. Able to place the feet together independently and stand for the 1 minute with supervision. 2. Able to place a feet together independently but unable to hold for 30 seconds. 1 needs to help to attain the position but able to stand the 15 seconds with feet together. 0 needs to help to attain the position and unable to hold for 15 seconds. 8. Reaching forward with outstretched arm while standing. Instruction. Lift arm to 90 degrees. Stretch out your finger and reach forward as far you can. Examine your places a ruler at the end of the fingertips. When arm is at 90 degrees, the finger should not touch the ruler while the reaching forward. The recorded measured in the distance forward that the finger reaches while the subject is in the most forward lean position. When possible, ask subject to use both arms when the reaching to avoid rotation of the trunk. 4. Can reach forward confidently 25 centimeters, that is 10 inches. 3. Can reaches forward the 12 centimeters step. 2 can reach forward to 5 centimeters safely to 2 inches. 1 reaches forward but needed the supervision. 0 loses the balance while the trying requires external support. 9. The pick up the object from the floor from the standing position. Instruction. Pick up the shoe, slipper, which is placed front your feet, before able to pick up the slipper safely and easily. 3. Able to pick up slipper but needs the supervision. Through second unable to pick up the reaches through 5 centimeter to 1 to 5 inches from the slipper and the keep balance independently. 1 unable to pick up and needs the supervision while trying. 0 unable to reach to try needs to assist the keep up the losing the balance or falling. 10. The turning to look the behind over the left and right the shoulders the while standing. Instruction. Turn to look direct behind your over towards the left shoulder. Repeat to the right. Examiner may pick and the objects to look at directly behind the subject to encourage a better twist turn. 4. Looks behind the from the both side and the weights the shift well. 3. Look the behind one side only. Other side the shows the least weight shift. Second, turn the side the only the maintain the balance. 1 needs the supervision when turning. 0 needs assist to keep from the losing a balance or falling. 11. Turn 360 degrees instruction. Turn the completely around in full circle. Pause. Then the turn a full circle is the other direction. 4 able to turn 360 degrees safely in the 4 seconds or less. 3 able to turn 360 degrees safely one side only in 4 seconds or less. Second able to turn 360 degrees safely but slowly. 1 needs the close supervision or a verbal causing. 0 needs the assistance the while turning. 12. The placing alternate the foot on a step or a stool while standing unsupported. Instruction. Places the foot alternately on the step or stool. Continue until the each foot has touched the step or stool 4 times. 4. Able to stand independently and safely can complete to 8 steps in 20 seconds. 3. Able to stand independently and complete 8 steps in 20 seconds. Through able to complete the 4 steps without it with supervision. 1 able to complete 2 steps needs the minimal assist. 0 needs the assistance to keep from falling unable to try. Standing unsupported, 1 foot in front. The instruction. Demonstrate to subject the place 1 foot directly in front of the other. If you feel that you cannot place your foot directly in front, try to step for the front of ahead that the heel of yours the forward foot is ahead of a toes of the other foot. To score the 3 point, the length of the step should exceed the length of the other foot and the width of the stance should approximate the subject's normal stride width. 4. Able to place the foot, stand on the independently and hold the 30 seconds. 3. Able to place the foot of the independently and hold the 30 seconds. 3. Able to take a small step independently and to hold the 30 seconds. 1 needs the help to step but can hold 15 seconds. 0 loses balance while stepping on the standing. 14. Standing on one leg. Instruction: stand on one leg as long as you can without the holding. 4. Able to lift leg independently and hold the 10 seconds. 3. Able to lift the leg independently and hold the 5 to 10 seconds. 2. Able to lift the leg independently and hold or 3 seconds. 1 tries to lift the leg unable to hold the 3 seconds but remains standing independently. 0. Unable to try or needs the assist to prevent the fall. Thank you so much.